Hello everyone, welcome to Radiology Case Review Series. In this video, we are going to look at images of an elderly male patient who presented to emergency department following fall. He was complaining of right-sided chest pain. Patient had recently undergone endovascular stent graft repair of thoracic aortic pseudoaneurysm approximately 4 weeks ago. Emergency department physicians were concerned about rib fractures and patient was referred for CT examination. On the CT examination, as I scroll through, we can see non-displaced fractures involving anterior aspect of the right ribs. 2 consecutive ribs were involved. It was also noticed that adjacent to the thoracic aortic stent graft, there was a locule of gas. It was unclear if this gas was contained within the esophagus or it was extending beyond the wall of the esophagus, and the esophagus seems to be adherent to the thoracic aortic wall. No obvious mediastinal collection was seen. So this finding was alerted to the emergency department physicians. Patient was treated with analgesics and was discharged home. He represented 2 days later with massive hematemesis and he was referred for CT examination. Let's look at the follow-up CT. Patient underwent CT examination with intravenous contrast. On the CT, we can see pseudoaneurysm versus endo leak along the superior aspect of the graft, which would be type 1A, and we can again see locules of gas in the mediastinum, which have increased when compared to the prior examination. There is also increasing soft tissue density in the mediastinum with few tiny low density foci. So the findings are concerning for aortoesophageal fistula. As I scroll down further, we can see large amount of hyperdensity in the stomach, which would explain the hematemesis patient was having. So the prior studies on the right and the current studies on the left. So we can clearly see this new pseudoaneurysm along the superior aspect of the graft with increasing mediastinal soft tissue density with some fluid foci and increasing gas. Findings are concerning for aortoesophageal fistula. Patient was in hemorrhagic shock and was taken immediately to OR for endovascular stent graft repair. So we can see the old graft and patient underwent aortogram, and we can see the pseudoaneurysm along the superior aspect of the stent graft. A covered stent was placed along the superior aspect to close the pseudoaneurysm, and post-procedure graft shows absence of flow in the pseudoaneurysm. So our patient who had undergone recent stent graft presented with massive hematemesis. Appearances are consistent with aortoesophageal fistula post TEVAR. In the literature, there are very few case reports. This is one of the case reports I found. The report nicely summarizes the findings and the differential diagnosis and possible etiology. So whenever a patient who has undergone recently thoracic aortic procedure presents with hematemesis, aortoesophageal fistula should be suspected in terms of differential diagnosis. In addition to aortoenteric fistula, which is pretty rare, other etiologies including hemorrhagic gastritis, varices, malarious tear, neoplasm should be considered. In terms of diagnosis, as we did in our patient, we can confirm the findings with CT angiogram. In terms of possible etiology, the reason for aortoesophageal fistula could be due to direct erosion of the rigid stent graft through the aorta into esophagus, or due to pressure necrosis of the esophageal wall due to ongoing forces from the self-expanding stent graft. I hope you found this rare complication of aortoesophageal fistula following TEVAR to be interesting and informative. Thanks for your attention.